Hi, my name is Julie Valerius. This is my share it presentation to all of you. Sorry, I've never used the camera on this thing, so I apologize for how awkward this feels. Again, my name is Julie Valerius. The purpose of this presentation is to share with you my project that I did, the practicum site, where I did my clinicals, what I've learned, and what kind of things I've reflected on during 472. So the site where I was Red Bud Regional. It's a small critical access hospital. I followed around the CNO, Dr. Janet Ruffin. She was a great lady. They have a 25-bed med surge, so they have medical inpatient and they have swing patients who are doing kind of rehabilitation. And they have a 5-bed emergency department. They also have an OR, labs, things like that. And they're affiliated with quite a few of outside doctor offices and an outpatient operating facility also. So the topic that I chose was how to increase HCAHPS scores by improving nursing communication. So I chose my topic, first of all, by, it was actually, I used a PowerPoint. I chose my topic the second day that I did my clinical time at Red Bud. There was an LDI video, Leader Development Institute. So they sent this video out to their hospitals and their facilities, and what happened is they go ahead and they rate their hospitals. They show them how they're doing for the quarter. And there were 198 hospitals in this CHS hospital group. And of those 198, Red Bud fell into the bottom 10 when it came to nursing communications. So I thought, okay, well, there's a great idea. Let's see what we can focus on with this nursing communication. So a lot of the things that I found in regards to literature about this topic, a lot of it revolved around bedside shift report especially, and doing some of the board communications, keeping up with communication, keeping it up to date and valid, and writing things down that the patient could really use to help in their own care. So the things that I did, I went ahead and one morning I went to watch shift report, just to see what kind of things they were doing, to see if they were going into the bedrooms, the patient rooms, and doing this bedside shift report. I went around to look at their boards to see if they were current, up to date, valid, effective, and I was just kind of watching how they interacted with some of their patients. And all of it actually seemed pretty darn kosher to me. So I had to ask myself, I don't really know what's going on. Maybe it's the patient population that they serve. For the most part, the population that they have up on the med surge floor is a group of, they're older people. So I wonder, what are the faculties cognitively of these people? Do they remember everything that was going on? Or are the nurses falling short sometimes when it comes to explaining them what's going on, things like that. So either way, I did find a lot of literature, again, that focused on the bedside shift report. And a lot of the things that I found focused on, like SBAR, the situation, background, assessment, and recommendation. I found some that did SBART. They added the T on there to make sure that you say thank you to your patients before you leave. I found one that did I-shaped. Now, this one was a new one to me. Introduction, story, history, assessment, plan, error prevention, and dialogue. I thought that was really kind of an interesting one. But what I did was actually follow a couple different things. So the Joint Commission has the thing out for safety. We know that the bedside shift report can really improve patient safety, patient satisfaction. And so I took the S-bar and I incorporated what Dr. Ruffin gave me from the corporate office, which was kind of an addendum that they sent to go ahead and do with the bedside shift reporting to go ahead and decrease hospital-acquired conditions. So the addendum included, I'll just show you a quick little thing. Ooh, can you see? There it is. So what I did was onto the S-bar, I added Q, and I made it S-bark. Anyway, it was my little project. So the S-bark, the Q I used for questions, ask questions. So the questions that we can consider are catheter-associated urinary tract infection. Do they have a Foley catheter? If they do, here's some of the questions and the things that we can look at. Is the necessity of having the catheter, has that been reviewed? Is the bag empty? Is there unobstructed flow? Things like that. The next one was central line associated bloodstream infection. So do they have a central line? And if they do, have they been given the CHG bath? Did the dressing need to be changed? Things like that. Also, are they at a risk for, are they a high fall risk? So what things have I done? Is the bed alarm activated? Do I have their collate within reach? Do I have their non-slip footwear on? Wounds and pressure ulcers. So are we turning them Q2? What does the wound look like? Is it approximated? DVT, what kind of things have I done for prophylactic DVT? Whether that be the TED hose, the SCDs, or is it medicinal? And then lastly was whether or not they're on isolation. So it talks about C. diff and initiating those practice bundles along with MRSA. So I took the addendum that the corporate sent out and I kind of incorporated it into their facility to use as a sort of cue. Along with the cue of just asking the questions for this addendum, I also wanted them to ask questions of, ask the patient, does the patient have any questions for me or for the oncoming nurse? And then does the nurse have any questions for me as I'm going off duty? So just to kind of wrap everything up in a sort of bundle and make the bedside shift report a little bit more complete. I also used this book, HCAP's Handbook, to learn about some of the tips that maybe we can use to improve nursing communication. So I put all of this into a PowerPoint and some handouts that I used for them. And I went and tried that sort of idea. So what worked well? Well, I think overall it kind of worked okay. The problem was that I went on a busy day, they were short-staffed, and of course I didn't have a lot of people show up. Another thing that I noticed is really a shortcoming is that when people are asked and surveyed about HCAPs, they can be asked about nursing communication or doctor communication. Well, there's a lot of staff that's included at the hospital. We have lab techs, we have patient care techs, we have PTOT, we have a lot of different things. And so if someone's doing a survey and they see nursing communication and doctor communication, they kind of bundle everybody else in with nursing communication. So we really need to take into consideration everybody that needs to be aware of and taught all of these different tips for improving that sort of communication. So using AIDET, the AIDET, using eye contact, how you approach the people, giving them time and making them feel like they're engaged in the conversation. So there are things that that not only do I need to talk about with nurses, but also the rest of the staff. If I had to change and do the presentation again, heck, I think I'd just be a heck of a lot more prepared for it. Maybe do it differently than just a presentation. I might incorporate some sort of some sort of different evaluation or questionnaire or something like that. And again, like I said, I was really probably going to include most of the staff instead of just the nurses. My takeaway points from 472, I have to tell you that I'm a very brand new nurse. I've only been doing this less than a year now. And I know it's my third career. It's not new. But so in nursing, I'm still very new, and I'm at the clinical bedside things, doing that for the patients. So looking at management and looking at patients' numbers and statistics and, readmissions and things like that, that was very different for me. It was very foreign for my head to wrap around. So that's something that I'm really taking away and that I'm really focusing on more. It certainly made me more aware of how I am communicating with my patients and if I'm taking the time to really get to know them and make them feel like they're engaged and part of their own care and process. So how will it change my experience? I have to tell you that it's making me look at nursing in a way different way. Like I said, there are things out there that I didn't really consider were part of nursing. And I find a lot of it interesting. Right now, a little overwhelming and scary, but I think down the road, it's something that I could pretty much consider, maybe management and things like that. And again, I'm taking away from my project that I really need to communicate better with my patients and take that into consideration when we consider our HCAP scores and our reimbursement or our incentive payment that we get. So Anyway, congratulations everyone on finishing the class. Talk to you later. Bye.